And I hope that no matter at what level you are in that process of your learning about trauma-informed care, that you will feel free and open to share your experiences and ask questions today. And that's what we're here for. And we have we can go ahead and close the poll. We have a wonderful speaker here today who has had a lot of experience with trauma-informed care, and and I have had several conversations with her, and I'm so excited to have her present today. So we'll get going in our presentation and get going quickly here. I am Wanda West. I'm the content lead for this training and also the facilitator. And we also have a couple of other Southwest support members on our team. Elizabeth Hume is providing the tech lead today, and Sheila Boswell is tech support. You may or may not see information that they post in the chat box. So if you see them, I wanted to make you aware that they will be active in the chat box, and that's who they are. We want to let you know that we are funded by SAMHSA. So these great trainings are made available through SAMHSA. The views, opinions, and content expressed in this product are not necessarily reflecting the views, opinions, and policies of SAMHSA. And just to run through our objectives for today so that we all know sort of the roadmap and the direction that we're taking. Fabricia will take some time in the beginning to talk about the impacts of trauma and how that can have an effect on the delivery of our prevention services, both to individuals and communities. So when you're thinking about trauma, we're thinking about individuals that we serve. Some of you work on the program level, and some of you work on the community level. And certainly anything we do in the community also has an effect on individuals, and we're working with individuals who have experienced trauma. And so she'll go into a real good description and background information on that, so that we can begin to get a picture at first. And then we'll talk about those core principles of trauma-informed care, which are safety, trustworthiness, and transparency, peer support, collaboration, and mutuality, empowerment, choice, cultural, historical, and gender issues. So be thinking about those principles and what they may mean in your prevention programs in your community and the individuals that you work with and the things that you are already doing. And then lastly, we'll talk about and identify 5 individual self-care domains to prevent secondary traumatic stress. And we're going to even practice using some self-care and emotional regulation. So that's going to be fun. And so if you all have self-care ideas, things that you do to help prevent secondary traumatic stress in yourself, get ready to share those in the chat box. What we're going to do today is pull together all the resources from this training. If you have links to things, feel free to put those links in there. And we are creating a resource of information so that we all have access to that. So get ready, because we want everyone to participate. This is Fabricia Prado, and you can also see her in the video right there. She is a licensed clinical social worker. She works with Prado Counseling and Consulting. And if you saw her, the registration information for this training, you saw she has a lot of experience working in ACEs. She is an ACE master trainer and has just, I think the thing that I'm most impressed with Fabricia is that she's just really gotten hold of this information and is willing and excited and motivated about sharing it with everyone she can. So we're so grateful that she's here today, and I'm going to turn the time over to her so she can get started. Thank you all again for being here.
Hello, everyone. Good afternoon. I am, so I want to first thank all the Southwest BTTC team for making these webinars possible and available to all. There is a lot of work involved in this collaborative process. And I want to give special thanks to you, Wanda, for all your support, for going the extra mile to obtain the videos, for being so patient and kind, and for all the conversations we had about ACEs and prevention, and for facilitating our cohort exchanges since our ACEs TOT training in October of 2019. I want to say a big thank you for the amazing professionals in the field of prevention from different parts of the world who recorded their videos to share with us today about their experiences with trauma and self-care. Hamilton Rezende from Goiás, Brazil, Coti Espinosa from Atlanta, Georgia, Di Gaiata from Italy, Chloe Sanders from Oklahoma, and Jeannie Adam from New Mexico. Thank you so much for your important contributions. I want to start by saying how hard it is sometimes to recognize trauma. Trauma can be invisible or disguised by something else that calls more attention or appears as a subproduct of being traumatized with different names, like depression or opposition on defiant behaviors, homelessness, or even physical illness. Often people don't connect their traumatic experiences with their current problems. As a clinical social worker, I learned it very early, and that's what made me focus on understanding more and more about trauma. My professional motivation to learn more about trauma-informed care came later from witnessing some of those traumatized people who are avoiding interactions with systems and institutions like healthcare, schools, because of mistrust and confusion, lack of safety, and re-traumatization that can happen when seeking help. I am also highly motivated to work with trauma and trauma-informed care in a personal level, as every cell of my body knows and have suffered from not knowing why my body was doing that and what it was doing and why it was so difficult to find help. Having my body functioning in survival mode in this chronic state of perceived threat for so long, developing even secondary traumatic stress and having difficulty to use my resources or sometimes not having enough resources is the basis of my motivation to share this with you today. If you are a student, an intern, a community leader, a peer support, a manager, supervisor, maybe a director, I am trying to make this message as open as possible and inclusive to everyone. So in this screen that you see now, I want to create some expectation and anticipation for you. I want to help you to understand why it is important to recognize trauma and the need of trauma-informed practices in your work with your communities. But I really want you to focus on you as an individual as well. And how are you when you're doing your work? The focus of this presentation is also on self-care, which begins with self-awareness, and how trauma can look like, how it manifests, and how we need to perceive it as trauma responses. And then trauma-informed care will help us to know what to do and how to respond. And then how to take care of ourselves while we do it so we can do our jobs in a way that it's safer, more effective, and ethical. How to intervene in a manner that all aspects involved in the practice of prevention work, including interpersonal relationships with staff, peers, clients, communities, organizations, and systems, prevents re-traumatization of individuals and communities. So I will ask your flexibility to shift from topics that you go from trauma to trauma in the nervous system, to trauma-informed care, and then self-care. So if you can, allow yourself to make this movement of zooming in and out of yourself and applying the reflective questions that we'll be asking as they refer to people you serve, the organizations and people you work with, and also to yourself. I invite your participation by typing your answers in the chat, and there will be the sharing of the videos I mentioned from these professionals who are contributing with their experiences. I may use a few personal examples or case examples with not much detail, but maybe if you feel a little bit agitated or anxious about things that you might hear here, meaning you might be triggered by something that you hear, I want you to try to give you a warning before each example to inform you what the example is about. If you notice that you need to self-regulate, take your time. Maybe you want to take this normal breath, and when you exhale as slowly as possible. Don't hyperventilate, like, and exhaling slowly. Just inhale normally and exhale as slow as possible. You may want to hold a half smile as you listen. You may want to feel your feet on the floor. You may even take your shoes off. You may tap slightly on the floor, your feet. You may want to color while you listen and participate. And please make yourself comfortable. Will you practice more self-regulating exercise at the end of the webinar when you talk about self-care? I do a lot of preparation and self-care to ensure that my nervous system is at its best when I am here. My intention is that this presentation also reflects the principles of trauma-informed care that we're going to be talking about today. So what is trauma? This is the SAMHSA's definition for trauma, and I want you to read through it and think about also these aspects of trauma. I want you to consider the following: the event itself, the severity, the frequency, the intensity, and the duration of the event. Was it one incident or several, continuously or in different points in time? Was it experienced by an individual alone, or by a group or an entire community or country? And who else was affected indirectly? Family, co-workers, all the others who showed up to help, who may have been indirectly traumatized, and how the fact that others were also affected will affect the person or the group who was directly exposed. In other words, when trauma happened, where did it land on? In which bodies? Think about ages, gender, in which brains, fully developed or in development, in which type of living conditions, historical moment, social context. Did intergenerational transmission happen? Was there any previous traumas? All these factors can aggravate long-term consequences of experiencing trauma. An important takeaway from this part is that the focus on events places the cause of trauma in the environment, not in some defect of the individual, which is the basis for trauma-informed care. To counterbalance the negative effects of the trauma event, we also consider protective factors, resiliency, and strengths. And lastly, the potential for post-traumatic growth, which is the phenomenon of experiencing positive psychological changes following extreme stress or a traumatic event. Positive changes such as improved relationships, new possibilities, a greater appreciation for life, a great sense of personal strength, and spiritual development. Post-traumatic growth can be used effectively. However, we need to be very careful not to jump too fast on it. When you work with individuals and communities who have undergone trauma, we need to first know where they are in their process of healing. And normally, in the beginning, there's a huge need for validation. We need to recognize the damage. We need to acknowledge wrongdoings, terror, and injustice. We can't move forward without sitting enough time in this uncomfortable place that is to recognize pain, what was lacking, what was wrong, horrific, even brutal. And who will tell us how much time is needed to stay in this place are the survivors. As much as you want to instill hope and say that everything will be all right, that there is resilience, neuroplasticity, and that they can find great transcendent meaning as post-traumatic growth, you may risk invalidating their pain in need of recognition and prolong their entire healing process. Forgiveness can also be very powerful in healing, and it is a complex topic. I won't be addressing it here. But when I hear a trauma story and right after a statement of forgiveness, I have to take a step back for a moment and assess what it means for the person, and if this is inhibiting or suppressing in unhelpful ways their presentation or manifestation of trauma. So now we start talking about types of trauma. As we move from the definition of trauma to types of trauma, I will speak a little bit faster and firmer because we do have a lot of information in this slide. We won't have other slides like that, so please be patient. I will not talk about the adverse childhood experiences study today, but please remember that the ACE study is ongoing, and it was the landmark that contributed to the progress of preventive efforts in resilience and childhood trauma. There is an amazing webinar by Dr. Laura Porter, Understanding the Science of Trauma, which was presented as part of this series of trauma in prevention, and the link is available in the chat. Please check the link on the chat and subscribe. So you may hear adversity, trauma, and toxic stress being used interchangeably, but adversity is a broader term that describes a range of circumstances or events that threaten physical and psychological well-being. If events are severe, chronic, and occur during childhood, this can result in trauma and toxic stress. So trauma is a possible result of exposure to adversity. Toxic stress is very different from stress that is positive or tolerable, like when you have to go to a job interview or getting married or doing a presentation like that. Toxic stress describes the effects of excessive activation of stress response systems on a child developing brain, as well as immune, metabolic, and cardiovascular system. These complications of trauma and toxic stress can happen especially without adequate support from a caregiving adult. In the community in prevention setting, there are types of things that you may see in individuals and groups that may look like the result of exposure to adversities, which can result in those types of traumas that you can see there. Developmental trauma refers to these childhood traumas of abuse, abandonment, neglect, all that the ACE study refers to. They can be multiple and chronic, and they are a good description of the types of events that can cause what you can see on the right side, on the right column, called complex PTSD. How does it look like? Developmental trauma. So in children, young children, you may see fear of being separated from their parents. You can see a lot of crying or screaming, eating poorly, nightmares. In older children, you may see anxiety, guilt or shame, concentration problems. And in older adolescents, you can see depression, body image, eating disorders, self-harming behaviors, drug use, and sexual risky behaviors. Historical trauma, we are going to refer about this cumulative emotional and psychological wounding over the lifespan and across generations, coming from massive group trauma experiences like genocides and ethnocides. For instance, Native Americans undergoing federal policies of removal, termination, relocation, and assimilation, diseases unfamiliar to the people. With collective trauma, we are going to consider an event or a series of events that shatters the experience of safety for the group or groups of people, such as wars, natural disasters, mass shootings, and of course, COVID. We are all surviving. Some are actually not, and others are thriving. In this collective trauma we are going through now with this pandemic, there is traumatic grief and loss, and some communities are going through that on top of continuous reactivation of threat responses that they already live on due to these other types of traumas, like community trauma that affects social groups or neighborhoods that are subjected to interpersonal and structural violence, historical harms with roots on historic and ongoing social inequities, poverty, racism, sexism, oppression, and power dynamics, and the erasure of culture and communities. On the right side of the column, you can see this psychiatric diagnosis, and I briefly talk about them. Acute stress disorders, ASD, starts typically immediately after being directly or indirectly exposed to traumatic events and lasts from 3 days up to 1 month. You need to have around 9 or more symptoms from 5 categories: intrusion, like nightmares, intrusive recollections, negative mood, changing worldview, difficulty experiencing pleasant feelings, connecting with others, self-blame, dissociation, like flashbacks, depersonalization, avoidance of places, people, or avoidance of even talking about it, arousal, hypervigilance, irritability, aggressive behavior, self-destructive or reckless behavior. This is also shared with what goes next, post-traumatic stress disorder, PTSD. The difference is that the PTSD can develop much later in time and can last longer. And also ASD has more of the dissociative parts of it, even amnesia, like forgetting some important details or parts of the event. PTSD can follow ASD, but it can also occur even when ASD does not develop and include all of those categories that I mentioned before. Complex PTSD are multiple chronic and prolonged developmental adverse traumatic events, most often of interpersonal nature, like neglect, community violence, abuse, and they normally start early in life. Since these events occur with the caregiver, this can affect also secure attachment. Good examples are children in foster care. One of my internships was co-facilitating a substance abuse prevention group in a group home. And my internship in my program started in the first semester. So the first thing I learned, it was that if they first trust you and they have to really like you and approve you, if this doesn't happen, there is no amount of technique that you use that you help. And they also, you test you. Now, vicarious trauma is an older term from the 90s to describe the process of changing our worldview as it becomes more negative when you work with people who have been through so much trauma. So we start feeling like the world is a bad place to be and becoming very negative as a result of empathizing and engaging with traumas from individuals and communities we work with. All of a sudden, everything is bad and we become overwhelmed. Compassion fatigue was coined in 2005 by Figley, who created a model to explain how compassion fatigue develops with these internal and external factors, as well as individual vulnerabilities like personality, our boundaries, unresolved trauma that you may have, and our personalities. And this is very used and used interchangeably too with secondary traumatic stress, which all refer to this indirect trauma that mimics PTSD. When I was working with kind of a large caseload with adolescents who had experienced trauma, I started noticing some PTSD symptoms, especially nightmares. And I was becoming more aware of how I was mimicking their symptoms in my experience. So all these symptoms, they may start suddenly. With burnout, I did include here, but burnout is a little bit different because it's more organizational and can develop more gradually. And burnout is more that dissatisfaction with work, with feeling exhaustion and feeling powerless because you cannot do so much about it in your work environment. Now we are ready to continue. We are going to transition now to trauma in the brain. And again, as I said, that was the most difficult part of definitions. So what you see in this picture there is the hand model of the brain from Dr. Dan Siegel. And I want you to maybe use your hand and try to do it with me. So simply fold your thumb in the middle of your palm and then close your fingers. This is like your brain, okay? This part here is the prefrontal cortex. This is the last part of the brain, right, to develop. The most primitive ones, we start, you have our cervical column, we have our spinal cord, we have our brain stem here, and we have our limbic system and the amygdala, right, in this middle area. And then our cortex. So during times of danger or when your emotional buttons are pushed, the limbic thumb is put under pressure. There is a lot of activation in this part of the limbic system. This causes you to flip your lid. Flipping the lid occurs when your limbic thumb is aroused and the flight, fight, freeze, or fawn response is activated, pushing open your cortex finger. That means this part doesn't participate much. This is off, okay? We are having a lot of activation here in this part of the brain. Remember, the cortex is the part of the brain where you think it's the solving problem part of the brain, right? And when this is not participating so much, we are pretty much in this overflow of activation that also activates our system to releases all the stress hormones in the body, like cortisol and adrenaline. So the flipping the lid is an unintentional reaction. You are not choosing to engage in it and act out. This is automatic. It doesn't involve thinking. This is your body saying, there is danger, let's survive. Now, when there is trauma, and think about all the characteristics of trauma that we talked about, what happens is that the brain is constantly in this state of activation. It's almost never like that or relaxed. It is constant activation. Dr. van der Kolk uses the analogy of the amygdala as being the smoke detector, sensing threat and activating and releasing these stress hormones so the body can prepare to run away or fight back. But trauma can increase the risk of perceiving something relatively safe or at least not life-threatening as an enormous threat. And then again, we're gonna flip our lids and release these stress hormones. Like when there is, smoke in the kitchen, let's say you burn some toasts, and then that little smoke sets off your smoke detector. So the alarm goes off as if the house is on fire and was just a little bit of smoke. So can you see how exhausting this can be to the body? Now, if you're calmer, if your frontal lobes can restore your balance by helping you realize that your body's response is responding to a false alarm, your body can then abort the stress response in the body. That's why we want to work on deactivating and calming the body, working in this bottom part of the brain. So in this next slide, we're going to talk about what type of responses can happen. So when the amygdala is activated and you're sensing threat, we are most familiar with hearing fight and flight, sometimes freeze, but I also like to include this form, which was used by Pete Walker, who studied complex PTSD. So if it is flight, how does it look like? If we have a flight response, what are you going to see? We're going to see running, escaping dangers, maybe even it can show up as a form of generalized anxiety, panic attacks, OCD to avoid the experience of fear, dread, overreacting, restricting, or addictions. They all can be a type of flight responses. As I was speaking with Wanda earlier, she's telling me there is this tornado warnings and there's a lot going on in there, and she's right there with her escape plan. So her body is in a flight response since there is a perception of threat that the body needs to do that, right? And respond. If she hears something or sees something different when she looks outside, she'll just run and not even think about it, just run. Hopefully she'll be safe. We can have fight, we can have attack, assault, talking back, aggressiveness, irritability, conduct problems, hyperactivity, a lot of talking back, like reacting, fighting back the perception of threat or danger. Freeze, when you cannot escape or stop the danger. Attack or abuse, like hiding, depression, dissociation, daydreaming, oversleeping, excessive watching TV, like this disconnection, like just immobilization, becoming almost invisible, or if you're dead. So this is a really immobilization response. And then we have fawn, which, it is more this active acting in submission and trying to calm down the attacker, almost trying to please and doing everything you can to avoid conflicts, to do everything to appease or prevent the attacker to see or to do something. So we see this a lot as codependence. We see this a lot working with domestic violence. And is this very, to me, it is a very difficult response to see. It is somewhat more disturbing because there is this surrender for the abuser. Children can do that too. I'm taking a course now in webinar for online, to do it online. And the presenter gives an excellent example of a child being, let's say, receiving any form of abuse and then extending their arms to the caregiver, like, stop it. I am here and I'm surrendered, do whatever you have to do, but surrender. So this submission, this active engagement is the type of fawn response. Think about how we respond to these trauma responses in a more understanding and compassionate ways to some of them. Isn't it curious? And not so much to others. But the fact is that they all are manifesting differently a form of survivor. They are doing the same thing. They have the same function, which is to adapt and survive. Here I have continuing this idea of the trauma responses, I have this graph that I think it's very helpful to illustrate the idea of we have this window of tolerance. Look at this green area in the graph. This is the ideal balance of the parasympathetic and sympathetic activation of our nervous system. Dr. Dan Siegel coined the term window of tolerance to describe this ideal zone where we can function effectively. We can say we are emotionally regulated when you're there. Polyvagal theory explains the complexity of those systems, focusing on the vagus nerve and interactions with the environment, relationships, communication, connection, and seeking to establish safety, and also calls this comfort zone as window of tolerance. In community resilience model, which is a resilient-based approach to teach us to reset our nervous system to its natural balance, and also compassionate integrity training, which is a training I completed through Life University, they call it resilience zone. That's why I used both, window of tolerance or resilience zone. We can have multiple windows for different situations, and they can change according to vulnerability factors. It is different for everyone. We all have different windows, and it can be reduced or extended. Trauma normally shrinks our window of tolerance, but there is hope because there is resilience, and resilience skills that can also expand our window of tolerance. When you look at this graph, I want you to pay attention to the top where you see the red hyperarousal. That's the activation of the sympathetic nervous system. And that's when you see the fight and flight. So it's adaptation to aggression and trying to escape. When you see this kind of orange line going all the way out of the window of tolerance, going up, that's when we are in hyperarousal. Now, the other two types, you look down, the line in the hypoarousal, and that's the activation of the parasympathetic nervous system in way down, like in freeze or fawn responses, adapting by disappearing, by conserving energy and resources for immobilization. So if you see like going down there, that's like depression, disconnection, numbness, dissociation states. So this is how up and down we can go in our nervous system. And what we want is to stay in our balance. In compassionate integrity training, I learned that this regulation of our nervous systems that has the potential to bypass or short circuit all other considerations. If you are stuck in the high zone or the low zone, right, being agitated or being too disconnected, we have very limited ability to use discernment, understanding our own and others' emotional states, and make good decisions. And it will be hard for us to act with compassion, with integrity, and to our benefit or benefit of others. If we do learn how to regulate our bodies, then we are using the natural resilience of our bodies to practice self-care in a profound and meaningful way.
Fabricia, we have a question, if we can go back to that slide real quick.
Okay.
So Kat has a question, and she's curious about your thoughts. She said that she's heard that the amygdala has no sense of time, that it was described as perpetual. Now, when the amygdala responds, it is as if everything is happening now. She's curious about your thoughts.
Right. The amygdala, it doesn't involve thinking, right? It's this more primitive way of responding because we can't, if there is an imminent danger, we don't have time. It happens in a flash of milliseconds that the amygdala is activated. This is the lower road. There is a higher road that goes to the thalamus, that goes to the cingula and the cortex. And then there's a little bit of thinking, right? But when it's only the amygdala like activating, sensing or perceiving threat, this is like instantaneous. This is immediate. And I think what you're commenting is how this happens like really fast, and there is no maybe I didn't understand very well the question, but what I understand is this immediate response without mediation of a lot of thinking or timing. And yes, trauma can like the smoke detector example, we can start perceiving threat where, you know, with the minimum like changes in facial expressions, people's voice can be a perception of threat and respond like that. When we do this self-regulation and trying to help our bodies to calm down, we are also trying to delay these responses, like mindfulness, for example, learning this neuroception to pay attention to our physiology, our body responses. That will help us to notice, labeling what is happening, and then giving ourselves this time to notice where we are. Where are you? If you look at our window of tolerance, where you can see there, let's say something is happening to me right now, and I can engage in becoming aware of what I feel in my body, what are the cues that my body is giving to me. And then I realize that there is this activation. What can I do to bring my body to a state of deactivation? Because I already engaged my brain to tell me this is not life-threatening. I'll give you one example. Every time I was preparing for this webinar and my body was going to fear mode, going out of my resilience zone, and my mind would make something up about what I was experiencing, like, you know, if it was something more than stress. Wanda doesn't know that. You're gonna know that now. But when you're talking, you know, in our conversations in the beginning about this webinar, Wanda made a statement. She said something to me over the phone. She said, "You are going to have a lot of stress during the next weeks." And then I used that statement as my cue to regulate myself when I noticed that my body response to that was saying that this was something else than just stress. Then Wanda's statement would come to my mind, and I would add, "This is just stress." And then I would smile at it and say, "Welcome, stress. I know you, you're my old friend, and I know how to manage you. I know I'm good at managing stress. So it's a stress." And then I would respond more in a way that was more realistic to what the threat was actually mean. I'm not sure if I answered the question, but that would be my comment.
And Kat, if there's more, feel free to open up your mic and you can ask that if what you're looking for is something different. While we're doing that, just to, I feel like, you know, as I looked through the, those of you who signed in and let us know what type of agency you worked for, we have a lot, you know, a wide variety of groups, and domestic violence prevention, those of you who work with youth, those of you who work with juvenile crime prevention. So as you were listening to this, I know I was, were you thinking about individuals or community members, situations that you have come across where you've experienced individuals or that, especially when I was thinking about the trauma in the brain, when you're thinking about someone who is in a continual stressful situation, when there's chaos in their family or in the community that they live in, some of those things that their brain is continually, you know, that prefrontal cortex is always up. So I'm just wondering how many of you experience that in the community and as you're working with them, and if you're already starting to kind of connect with some of that information. Yeah, so Andrea says, yeah, working with the selective groups of kiddos, it's important to keep this in mind. Sure. So, because many of you do work with kids in the schools, and so this was great. This is great information. So we're going to move into the trauma-informed care and how we can be more tender towards those situations. And we appreciate this wonderful background information you've given us so far, Fabricia.
Thank you, Wanda, and thank you for everyone sharing in the chat. And I can see how, yes, sometimes it is harder to work when the reactions are more the fight and flight sometimes, because it can affect us directly as well, and also put us, our own system in alert, right? And then we have to recognize when this is happening. And we need to also remember co-regulation, polyvagal theory. I like that contribution about reminding us of how our nervous systems interact and we co-regulate. Like if you are dealing, someone wrote in the chat, talking with selective group of kiddos and with angry reactions. So we want to remember that if someone is there in the red zone, in the hyper arousal, and if I lower myself even, I calm myself even more, and I really find my anchor to be really in my calm, then chances are that with time and interacting with that other nervous system, which is in agitation and hyperarousal, we may start coming a little bit closer. On the other hand, if someone is like shutting down, dissociating, I become more energized, more engaging, and more present, and bringing the presence of the person as well. We are also co-regulating by bringing our nervous system into this more harmonious way of relating with each other. So I want to continue by sharing with you our first video. This was a question, and I asked these professionals, excellent professionals, to answer this question, recording a 60-second video. So they didn't have a lot of time to answer. And the question is what you see there in the screen. So first we have Coty Perez. She has specialized in planning and implementing prevention education programs about HIV and AIDS in the Latino and African American communities. Currently, she works as a community outreach advocate, providing support and advocacy for survivors of domestic violence. And she's also on the board of Latino Link, promoting LGBTQ support in Georgia. Thank you, Coty, for sharing your experience with us. And second, we have Jigayata, who so kindly recorded this video for us in less than 60 seconds and shared very important experiences and things that she did that we're going to be talking about when we talk about trauma-informed care and self-care. So let's watch this first one. Oops, sorry.
Sono Giga Iatta, ho 31 anni e sono un assistente sociale. Ho collaborato con il Ministero della Giustizia per seguire sia adulti che minori autori di reato. Indubbiamente è un lavoro bellissimo, ma è anche un lavoro che rischia di diventare una fonte di stress tale da portare al burnout. Per prevenirlo, quando ho sentito che la situazione mi sfuggiva di mano, sono ricorsa a diversi strumenti. In primo luogo ho parlato con la mia tutor, in modo tale da chiarire maggiormente ed interiorizzare quali fossero i limiti entro cui sentirmi responsabile di ciò che accadeva agli utenti, e anche per imparare a essere meno critica ed esigente con me stessa.
Hola, tengo un poco más de 20 años trabajando directamente con la comunidad y he podido conocer a muchas personas que han enfrentado traumas como violencia doméstica, violencia sexual, un diagnóstico de VIH, discriminación cuando han buscado servicios médicos o discriminación por su orientación sexual. He aprendido a través de todo este tiempo a escuchar con atención, mirar a los ojos, mostrar una sonrisa amiga, ser empática con el cliente. Esta es una buena herramienta para poder dar un servicio culturalmente apropiado y nos ayuda a ponernos en los zapatos de la otra persona y agrega esa familiaridad en la interacción del momento.
Thank you so much again for this contribution. And I think it's so, so important, everything that they mentioned. And I want to ask you now, maybe you want to type very quickly in the chat, how do you deal with such encounters? Like when you see trauma in the populations you work with, like Koti mentioned how she works, with domestic violence, and supporting communities who are under constant state of stress and this activation of the nervous system. And also Jiga talking about working with offenders, minors, adults, and how she mentioned this was getting out of control. So she realized how this was having an impact on her. So see if you can think of how do you deal with these encounters? Do you even recognize these trauma responses being manifested in front of you when you work with your communities? I don't see any answer in the chat, but I will ask you to think about it. Okay, and you can still think about it throughout as we talk about it. So Angela is sharing how she even ended up retiring her license working with offenders. So, and this is part of what Jigayata shared in her experiencing and feeling out of control and going to her supervisors and asking and having to intervene. And I am sorry to hear that you regret that, but it is, and with me, I also experienced that. And sometimes we just know what was happened after. Later, you learned what was actually happened and what you could have done. But then you can still try to do it in different ways, even if you're not in the field anymore. So now I'd like to transition to trauma-informed care. This is the definition from SAMHSA. And I want you to pay attention to these 4 R's. 1, realizes the prevalence of trauma. 2, recognizes how trauma affects all individuals involved with the program, organization, or system, including its own workforce. And 3, responds by putting this knowledge into practice. And 4, resist re-traumatization. This knowledge can be transformational, but let's not think about it as a tool to be used against organizations and systems, but it is needed to identify the gaps in healthcare and health disparities where re-traumatization is occurring and why some people avoid seeking services or are not being reached out. From leadership, there might be some resistance, discomfort, denial, maybe even minimizing that these issues are there. But if you really want to improve in a collaborative manner, we need to identify the strengths and the flaws and gaps in the systems that are happening for not observing and responding to the realization of the high prevalence of trauma and its complex implications. In this presentation today, we're going to be focusing more in the communities, not so much in the organizations, but keep that in the back of your mind too. Trauma-informed care is becoming standard approach, not only to healthcare, but it is expanding to all segments of society, including schools, nursing, police. There is the ASSERT Manchester's Adverse Childhood Experience Response Team, set up to make police and communities more versed on ACEs. They do 3 times per week follow-ups in teams with an officer, a family, and a crisis advocate to help families to get things that they need. Trauma-informed care was established as a response to the shocking reality that it started to be revealed by the ACE study, and it is ongoing. And it is just reinforcing that you need to pay attention to these needs. And how we do that? So we can follow we are going to start talking about these 5 guiding principles of trauma-informed care to help us, to direct us in how to pay attention, to engage with communities, individuals, and systems in a way that it is trauma-informed. So I explain one by one their definition, giving examples, and asking you questions that comes from my own experience and also from this very helpful self-assessment planning protocol from Fallot and Harris, creating cultures of trauma-informed care. The first one, safety. And then there will be a chat question for you there. Safety is in the core of healing from trauma. It is actually on the basis. Relationships cannot be established or gain the power to heal without safety. I like Dr. Van der Kolk saying that being able to feel safe with others is probably the single most important aspect of mental health. Safe connections are fundamental to meaningful and satisfying lives. Research has shown that a more comfortable and welcoming environment, and now we're talking about physical environment, tends to improve behavior. For example, rooms that are crowded, noisy, uncomfortably hot or cold, harshly lit, they are likely to let people more frustrated and agitated. Now, if you have spaces that are more comfortable, the temperatures are nice, more natural lighting, less noise, more soothing, maybe some neutral paint colors, they all can contribute to a more calming and pleasant environment. There will be a list of resources that will be shared to you. And I included there a website for Trauma-Informed Oregon. And there you can see an example of a trauma-informed design. Their new Department of Human Services building has been entirely designed to be trauma-informed with natural light, acoustic absorbing material to reduce noise, natural surfaces, cool colors, and etc. So now I want you to think in your physical environment. I know we're going to talk about the virtual too, because now we are mostly in a virtual environment. But if you think about your physical workplace, if you're already there or planning to be there, think about your classroom, school, university, maybe a clinic, hospital, shelter, or out in the community, maybe doing home visits. Think about also your team, your staff, your department. Are the common areas welcoming? There is privacy. How do you work with privacy? What about the signs that are out there? Are they clear, legible, culturally sensitive? What about the exits? Are they easily accessible? Are the doors locked or open? Can the staff perceive discomfort in participants? So think about how you can create ways to make your environment safe. Now, and I allow you to take some time and type in the chat your answers. And while you do that, I also mentioned the virtual environment. So think about privacy and confidentiality and how they are observed. See if there is any noise when you're engaging with families and communities you work with. Is the information available? Do you have constant changes of background or where you are providing services from? What is the plan B if we lose connection? Who else is in the home? How do you assess privacy and confidentiality there? You know, on the other side too of the people you are working with. You know, there is this, maybe they are in a different place. Do you have the address where they are right now when you are engaging with them, just in case there is a medical emergency and you need to call for help for them, for example? We need to think about all these elements of creating safety also in the virtual environment. There is predictability. I think this is a great point to work with trauma and reduce anxiety in a way that the virtual setting provides an open door for us to be finally mutual, right? They can also see our side. We can see their side. There is this thing of showing pets, introducing our pets, and all this can be used also to establish safety and to be predictable. We want to inform all the steps of the interaction, the program, everything that they are going to be going through, so we can establish a sense of safety. You know what is coming. The second one, Mackie said, I always make sure my background is pretty plain and non-distracting. That also can be self-soothing, predictable, calming, right? This is plain, distractible. It's just us here. The second one is choice, support choice, control autonomy. The interactions with individual communities establishes that everyone involved needs to know their rights and responsibilities, recognize the people being impacted by trauma. They need to gain this sense of control. Remember that trauma took it away from them. When we work with people who have been highly traumatized and consistently traumatized, what was violated in the first sense was control, was voice, autonomy. So we definitely want to make sure that we're giving it back. And we can do that in very simple ways. It doesn't have to be very complicated. We can start by asking them simple questions like, what is your preference? When would you like to meet? Or when would you like to provide this information or document? How would you like to be addressed? From all the options described to you about this program, which one do you think you need at this moment? Can they leave the treatment or the program anytime they want? Do they know about it? Can they interrupt when they feel like doing that? Can they invite family members to join the program or participate in a meeting with them? So all this is about being clear about choices, giving autonomy, creating this sense of strategies that will allow the participants to experience choice and control. The next one, the third one, is trustworthiness. So let's think about creating, again, these clear expectations with participants about what the program entails: clarity, consistency, transparency, and also our boundaries. We need to have clear boundaries and healthy boundaries to role model as we engage with communities and systems. Also internally in our own departments or programs, all decisions, changes are conducted with transparency. There is nobody getting paranoid about what's going on and they don't know. We need to also pay attention to multitasking while on the phone with clients or participants. Maybe we are typing at the same time. Can they hear it? Or can they feel this as lack of attention or lack of respect? And this, if this is felt like that, it could be even potentially re-traumatizing. So here's the question: how can services and work tasks be modified to ensure that boundaries are established and maintained clearly and appropriately? How can your program or your department, your work, create this honesty and transparency in your engagement with your communities? And you can answer that in the chat as well. Number 4 is collaboration. So with collaboration and mutuality requires valuing relationships and shared power. Here, we want to avoid the risk of telling only one story, leaving out the whole person with multiple stories and complexity. When there is shared power in decision, making it creates a space for people to be seen, heard, and validated. It can be part of the relationships that are healing, so people can have, who have been traumatized, can start trusting again. So then this is also the most logical thing to do. If we are making decisions about other people's lives, how not to involve them and let them tell us what they need, what would be the most helpful. So here is your question: how your program, practices, policies establish collaboration across different sectors within the community. Think about that for a moment. Sue is also sharing how she thinks about, being the other person's place, knowing what to expect, right? Also, being clear about leadership and what changes and expectations are coming up. So don't think that you have all the answers. That's a good one too. More listening, less talking. Excellent. This is also not promising things that you cannot actually deliver, that you cannot approach. That's very important to establish this trust, transparency, collaboration. We don't want to overpromise. Now, finally, I have other examples, but I will include them in the resources. There's a lot of things going on. In Georgia, we have Resilient Georgia, who is putting together all the coalitions for trauma-informed care and ACEs training throughout the state. And I just read in their newsletter how in Savannah, Georgia, law enforcement is partnering with Chatham County Public Schools to implement Handle with Care. I don't know if you have heard about it. It comes from Maryland, where Handle with Care has been implemented statewide since 2018. And this is basically when officers go to like a domestic violence situation, they respond to a call and there's children involved. Then there is this app that's controlled by the school that the officer can just enter one sentence that goes straight to the principals, to the school's principal, saying, handle with so-and-so with care, or so-and-so has been through a traumatic event. That's it, no details. And then the school can put into action their plans of referring that child to counseling, maybe helping with tutoring, postponing tasks, and do everything that they can to handle that child with care. So I will post these links and articles and examples to you in the resource. Now, let's move to empowerment. I know I cannot read everything that is being posted on the chat. I know you guys are saying excellent things and people are reading. Thank you for sharing your great experiences and ideas. And I will go through that too, because I want to learn from you too. So finally, focusing on empowerment. Individuals and communities' strengths and experiences are interactions recognized and built upon. Believes in resilience and in the ability of individuals, organizations, and communities to heal and promote recovery from trauma. It involves equity, inclusion, and commitment with all the voices in the community. So we want to overcome past cultural stereotypes and biases, invest in culturally responsive services, and value traditional cultural connections, recognizes and addresses historical trauma. So we need to give a lot of recognition and validation here before we move into any change and implementation and overcoming type of actions. So I also have other examples from the Community Policy Center from Urban Institute with the Health Equity Institute in San Francisco. They have an amazing trauma-informed community building and engagement model to address community trauma with residents in public housing and other marginalized communities. They share principles, strategies, and practices such as honoring history, celebrating culture, never overpromising, removing participation barriers, and addressing community trauma, and implementing programs and services to illustrate those principles and practices and values. So now you have the question, how do your programs, strategies and settings empower to build skills of those involved? I want to make sure we have time to have a little bit of answers, but I want to continue by sharing now the second videos. I know maybe we can go to the videos because you already have a lot of answers there, a lot of things that were shared that were really amazing. So here we're gonna go with our second set of videos.
Olá, meu nome é Hamilton José Amorim Rezende, sou fonoaudiólogo,
I apologize.
arteterapeuta e artista de teatro. Trabalho na Secretaria Estadual da Saúde do Estado de Goiás, Brasil. Sou coordenador de desenvolvimento humano e sustentabilidade em promoção da saúde. Coordeno também os projetos Cidades Saudáveis e Sustentáveis e o programa Saúde na Escola. Acredito que ações criativas são interessantes para a superação de traumas. A criatividade compreendida como uma condição humana. Portanto, cantar, pintar, brincar, cozinhar, montar uma mesa de frutas, organizar uma festa, estudar, escrever um texto, poesias, arrumar a sua casa, plantar e cuidar de um jardim. São inúmeras as manifestações criativas e elas estão presentes no nosso dia a dia. A criatividade é um processo dinâmico de auto-organização e todos os seres humanos são criativos. E quero destacar a dança, as danças populares, as danças de roda, as cirandas, as danças dos povos nativos, as danças dos povos originários. Uma comunidade que dança é uma comunidade feliz. E a criatividade gera saúde.
Ho deciso di staccare dal lavoro una volta tornata a casa e quindi di dedicarmi ai miei hobby, come la pittura, la musica o le passeggiate all'aperto, oppure ho deciso di impegnare il mio tempo iscrivendomi a corsi di formazione o a webinar.
Again, I'm so thankful for this participation and for this contribution from Hamilton, from Giga, and everything that you said, Hamilton, about creativity and how healing in Brazil they were using before the pandemic a lot of circular dances, and we talked a little bit about it. Hamilton shared with me a little bit more about his work and how this is growing in Brazil and as a healing practice for inclusion, for community. And unfortunately now most of the classes have been suspended, most of the programs involving circular dance. But it's also important for us to remember how creativity, how art, Giga also mentioned how she resourced to art, how she resourced to studying, taking webinars, things that can really help with regulating ourselves so we can stay and do our job the best we can. So I appreciate so much this sharing of this beautiful experience with creativity, Hamilton and Giga. And we have another.
Olá.
And now we're going to hear two other videos about self-care as our introduction to this next part. Now we have Chloe Sanders.
It can start to make everything in the world seem kind of sad or scary, that we see or experience bad things and all of a sudden our brains kind of start to generalize to see everything that way. And so for me as a professional, one of the biggest ways to practice self-care is to recognize when my perspective starts to shift in that way and I start to see the world through that lens. And the things that I've been able to do about it are two different things, but they both have to do with relationships. And one is to have really good relationships with other professionals who understand my work and know what it's like, so that I can go to them, I can be on a team, and I can kind of check my perspective with them and just get the support that I need from people who do the work alongside of me. So that's a really important key to preventing secondary trauma. And then a second thing for me is that in addition to those professional relationships, when I walk away from the therapy room, or maybe the job where there's something traumatic or scary that's happened, I'm making sure that I'm really investing in my personal relationships, that I'm having fun, that we're supporting each other, that I know that I've got people from my faith community, my friends and my family who have my back.
Excellent. Chloe basically summarized the entire part of the presentation for trauma-informed care. Excellent, brilliant contribution. We are going to refer to that when I am talking about self-care. You heard, like she's saying, support, communication, connection, also connection in our personal lives, letting the work there at work and engaging in our personal lives in a healthy way, and also nurturing from that. Very, very, very important. This is really a summary of everything that is to be said about self-care. Thank you so much. So now we have Jeannie Adam, so beautifully also shared her experience with self-care. Let's watch what she has to share with us.
Hello, my name is Ginny Adami, and I'm a Senior Certified Prevention Specialist working in Valencia County, New Mexico. When I entered the field of prevention, I was really looking forward to the opportunity to serve in my community and collaborate with others to increase the health, safety, and wellness of all. I envisioned working with others who were drawn to this field, and that our collective efforts would be well received. Clearly, that is not how working in the schools with law enforcement and community leaders goes on a regular basis. Working with people who have experienced trauma, becoming familiar with the real-life stories behind the data, and definitely working on policy when you face economic gains versus harmful health outcomes can be far more stressful than I ever imagined. This is why even our Prevention Code of Ethics realizes the importance of self-care for prevention professionals. For me, I literally take time and smell the roses. Nature and the outdoors is truly a source of refocusing for me, and it's a special reminder of the many gifts that I am surrounded with. Additionally, I find great healing in caring for my pets, who in turn care for me, and they are great listeners. Whatever it is that you do that brings you inner peace and joy, don't forget to do it. It is hard to teach others the importance of self-care if you're not a practitioner yourself first.
Thank you so much, Jeannie. This is lovely, and it makes me smile to watch this video and the sharing of the beautiful things that you resort to, and using nature, connection with animals, and these exchanges that are so nurturing and important. You also mentioned that this is ethical for us. So I loved it, and thank you so much for sharing this amazing and beautiful video. I want to go a little bit ahead with our self-care domains. I want to share a little bit with you about my experience as well. So with self-care, I want to tell you that the idea of self-care sometimes, and I'm skipping through some things here. So I want to clarify that self-care the idea of self-care can't be reduced to bubble baths or massages. Okay, we all know that. Second, it doesn't have to be very privileged and require money or sophisticated accessories. And third, it cannot be another chore or something you feel frustrated or guilty or shamed for not achieving again, right? Lastly, the how you even approach yourself and talk to yourself in doing things that release some of the stress and burden of today's times also matters. Self-care cannot be a band-aid for deep infected wounds that you carry with you all the time that gets poked here and there, and not because of you. I see self-care as a process of self-awareness, self-compassion, and recovery from the grief that is at the root of all that has been lost, stolen, and violated from trauma wounds. So let's take a look at these self-care domains. The first one is awareness. So awareness about the work stressors. Jeannie just said, I didn't know when I started what I was going to face. I didn't know it either, Jeannie. I didn't know what I was going to face when I started. This happens. This is very common. We don't know what you're going to face. So this can become difficult. If we know, we can plan things, you can take actions to minimize the negative impact of those factors that might be stressful to us. Self-awareness, checking with yourself. How are you feeling? Where are you in your resilience zone? What are your needs? What are your biases? Jiga Yata referred to her in her video by saying how hard it was for her to work with criminal offenders and being out of control and then experiencing burnout. So the self-reflection led her to seek supervision, consultation, and then engage in her plan of self-care. Balance. We want to have this fulfillment in several domains without sacrificing the others. Here you try to identify possible areas of your life that you are being neglecting and try to create some balance. Balance within the work. Are you doing the work of two people? Or maybe you're focusing too much on the details of the job and missing out the bigger picture, creating unnecessary stress to you and your team. I have done that. Are you taking more responsibilities than you can? That's another question. Work-life balance, leisure, and 3, we have physical health, of course, our need to sleep, movement. Hamilton mentioned dancing and how dancing and creativity is so important. So we cannot talk about it enough, how movement is important, nutrition, and substance use. Be watchful and be careful with that. Social support. We want to also have satisfaction with personal support, as Chloe mentioned in her video. Professional support, which she also mentioned. Supervision, peer collaboration, she also mentioned. And sometimes we need to seek therapy. There is some things that we need to be aware of and work on that we need this extra help. In spirituality, and here we have, all these connections and holistic healing types of healing for trauma. I'm reading a book now called Decolonizing Trauma, Indigenous Stories and Strategies by Renee Linkletter, which is a result of her PhD dissertation. And I'm learning a lot about how to see trauma through different lenses too, and also seeking healing help through different ways that don't over-pathologize or don't go in the direction of the Western psychiatry, but can be extremely helpful and can be extremely healing. Meaning making, right? Very important too. Mindfulness, cannot stress enough. Mindfulness. And I would like to share with you a little bit of my secrets too. I have established, I am a highly sensitive person, and working from home, it is an accommodation for me, which I take with no guilt or shame at this point in my life. I have established some practices. I call them rituals. They help me to keep myself in my resilience zone and be functional. I do value and cultivate self-discipline. And, I had to create a system that would work for me since 2016, when I started working from home, managing a telecounseling program with minimum supervision. I had to create a ways of work where I was productive and accountable on my own. So I created, this system that worked for me. We have to remember that we are not machines. Our bodies are not machines. I have a prayer meditation routine, and I have a type of altar in the specific corner of my office that I go to every day before I start my day. I read from different sources of books, inspirational readings. I have a lot of things for self-soothing, for my feet, for my hands, for, and I have my yoga mat just behind me. And I use very little social media. It's too overwhelming to me. It makes me dizzy. I'm very selective of what I watch and listen to and the people with whom I get closer to. But the most important that I want to share is I found out what works for me and shamelessly embraced it with my whole self without over pathologizing myself or comparing to what others are doing. I make it intentional and it becomes a lifestyle. There's something I want to tell you. We have to end. I just read this message from Wanda. We wanted to practice some self-regulation and resiliency tools. Can we have time to practice one short mindfulness?
You know what? We could do one very short one, and then the others I think that maybe we will have to provide in a resource for everyone. So I know every time we have one of these trainings, that's the comment we always get. I wish this could be longer. Now, here's something we could do. If there are some of you who would like to hang out a little bit longer, we'll have the question and answer section, and we'll put the evaluation link. Sheila, if you could go ahead and put the evaluation link for those of you who need to get off the training. If you would complete the survey. Yes, will you go to that slide, Fabricia? There we go. You can take a photo of that QR code with your phone and complete the evaluation right there. It's so simple and convenient. So if you need to get off the call, you have other obligations, feel free to do so. If not, if Fabricia agrees, we would love for you to walk us through some of those resiliency and self-regulation tools. So stay on if you can. I think this will be a treat. And then if you need to go, we sure appreciate you joining us today. And we will have a recording of the training today so that you'll be able to receive all of that information. It was a lot. And it was good stuff. So good luck in your communities and the work that you do. Please feel free to send us any questions, and you can send them now even in the chat box if you have questions as you work with your communities and how the implications to your work.
So for those who stayed, if you can stay for maybe 5 minutes, we can practice. And again, I stress the importance of practicing these self-regulation skills because this is a bottom-up approach. Remember, we are working with this part of the activation of the amygdala of our physiological responses, our nervous system when you practice those things. There are other things like CBT, cognitive behavior therapy, and other things that we can do to also work with cognitions. But in a way, we need to be able to self-regulate, to be calmer so we can engage with our values, our goals, our reasons, our purpose and mission for the work we do with our full, clear minds as well. So I would like to invite you to do this short, brief mindfulness of breath. This is the very, very basic mindfulness exercise that maybe if you have 2 minutes per day before you start your day, you can just, do this brief body scan and see, what are you feeling, how you're feeling, and using your breathing as an anchor to keep you grounded. And if you have distractions, if your mind goes to different places, also practice this gentle voice of bringing your mind back to your senses, to your feelings gently, okay? So I would like to invite you to sit in a comfortable position. You may want to close your eyes if you feel comfortable. You may just look down on a point where you're not going to get distracted. Ideally, have your back supported and your feet on the floor. Okay, so let's begin. Your arms can be resting on your legs or on the arms of your chair if you have. And just make sure you feel comfortable. It's not forced, it's your natural posture. And then let's begin by just taking this deep breath in and out. As you exhale, you might want to say a word like calm, peace. And then let's do it one more time. And exhale as slow as you can. And then I will ask you to bring your attention to your feet touching your shoes, maybe your shoes touching the floor or touching your socks. Just bring your attention to that sensation, especially of your feet on the floor. Noticing how most of the time when we are standing, when you're walking, that's how we are connected with the present, with here and now. And if you don't notice any particular sensation, neutral sensations, that's fine too. And gently bring your attention up to your legs, just noticing if there is any particular sensation there or no sensations at all. Then bring your attention to your abdominal area, your chest, your shoulders, arms, and hands. And as you notice, if any thoughts pass through, just notice the thought or emotion passing by and bring your attention back to the body sensations that you may observe. Then bring your attention to your neck, to your face, to the muscles around your eyes, your jaw, and your head. Notice if there is any tension and release. And then I will ask you to move your attention to your breathing, to the movement of the air coming in all the way through your nostrils, your throat, your chest, maybe your abdominal area, and all the way out. And we're going to stay there for a minute. Just notice the natural flow of the breath without changing it, making it faster or slower. Just noticing your breathing. And again, if any thoughts pass through, gently, as many times you need, bring your attention back to your breathing. And again, as many times you need, as gentle as you can, bring your attention back to the breath. And see if you can notice your breathing as this anchor for you to be grounded here in your body now. And then I will ask you to taking your time, gently start bringing your awareness back to your body, to the parts of your body that are touching your seat or the chair where you're sitting, and to your feet touching the floor. And then taking your time, you may start bringing your mind back to where you are, to this webinar, and you may open your eyes when you're ready. Thank you, Angela. And you may, just bring your attention back. I hope you're still there.
We still have about 31 people with us, so.
Wow, 31 people. Thank you so much.
Yes, that was wonderful.
So, and just to end then, thank you for staying. Very quickly, I will add this to the resource, but I really like also the butterfly hug. And this was a technique developed by Lucy Ortegas and Ignacio, I forgot the second name, in the as a working with victims of a hurricane in Acapulco, Mexico. And this is implemented in EMDR, that eye movement desensitization and reprocessing therapy for trauma, as a way of also stimulating, of bilateral stimulation. And I really like to practice that one too, as you are already in this position, so you can simply, there are two ways to do it. I like to do with the hands here. You just cross your hands and give yourself this hug. That's why it's called butterfly hug. It's also good to do with children. And you lightly tap right and left on your arms as you breathe. And this is also increasing bilateral right and left brain hemispheres. Remember that when I showed you the brain model, the hand model of the brain, this was a more vertical integration of the brain. Now we also have horizontal integration of the brain with our right and left brain hemispheres. And then we also want to work on integration by doing these exercises and skills that will help us to increase that. And anything, actually drumming, swimming, dancing, anything that alternate bilateral movements like that can also have this effect, okay? So when we are processing the breathing, processing difficult things, I hope there was not a hurricane that happened right there, Wanda, but if something like that happened, let's debrief. You can just do the butterfly hug while you talk to us about what happened. And hopefully nothing happened. Hopefully you're going to say the trees were moving side to side. That's it.
The trees were moving side to side. So far, so good.
Okay. So we just want to stay in this butterfly hug, for a couple of minutes, for 5 minutes if you need. You can also do it like this and placing it here touching like the collarbone with your finger, like up, like in the direction of your neck, and also tap here. Depending on what the person experienced, maybe sometimes some forms of abuse, physical abuse, this might not be the best option. So we need to be sensitive to that too. But that's another way to practice the butterfly hug. So I want to leave you with that. I want to thank you again for staying for so long. And these resources will be shared with you. Someone asked earlier in the chat about the app, the Handle with Care. I will add the articles and all the resources for you there too. Okay. Thank you so much.
We had someone request the bee breathing, a quick demonstration of that because they were curious.
Yes, I go for that. So the bee breathing is a yoga. It's called pranayama breathing. It's from yoga. This is the one that I learned the most recent, and through my friend who is a psychologist and a yoga instructor in Italy, and she started giving free yoga classes at 7 a.m. here on Wednesdays, and I was taking her classes, and I learned the bee breathing. It's normally practiced with yoga. So, and I read, how this is used in therapy as well. So I really like this one, really like it. To me, I'll tell you how my experience is. It is a little bit different than these two that you just practiced. Maybe you're going to sense a little bit more activation, not so much, a little bit. And to me, this feels like when I need to release something, and as if I could open my window and scream and yell, and release something. So the bee breathing to me feels like that. I also like that it's fun and you can make the sound, and I work with clients teaching that, and we kind of become vulnerable and you make silly things when you do that. So basically you cover your eyes and you also, with your thumb, close your ears like that. Okay. And then I do it one time and then we do it together. So I do this, cover my eyes and my ears, and I take a deep breath in, and I exhale through my lips without opening my lips. And it can sound like humming, okay? But I make this like a bee sound as I release. And you notice how when I release, this is really long. And that's what I like about it. I also like the vibration inside my head. And I like the feelings of that. Maybe some people won't like it. Okay, we have to really be sensitive to what is appropriate for someone. Maybe it's a no for somebody else. So I will do it one time, and then I will invite you for us to do it together. You can even unmute your microphone if you want, then you can make some beautiful sound exhaling. So here I go. Covering my eyes and my ears. And so this, you can practice not only one time, you continue and you go maybe 2 minutes until, I like to say, until you see and you sense a shift. So when I sense a shift, maybe I am good and then I can stop, okay? So I want to invite you to do it together. If you don't hear sounds coming out, that's okay. There's no way to do it wrong. Maybe you're gonna feel the vibration, but try to, as you exhale, really release the air through your lips without opening your lips, and allow yourself to make any kind of sound that you come up. Okay, it doesn't have to be nice or not nice. Nobody's judging what sound you come out. Okay, I don't know if you want to unmute your microphones or if you want to do in the privacy of your room. Okay, so let's do it together. Closing the eyes, covering both ears. Let's breathe in. I just realized you cannot hear each other because you're covering our ears. So I hope you had a good experience. Maybe you want to keep doing that for the rest of the afternoon.
And remember, we'll have these recorded, and I'm picturing just recording this section, cutting this section, and just having a whole section of self-regulation and resiliency tools that you can watch over and over again.
There you go. I forgot about this detail. It's being recorded.
Yes.
The simple grounding techniques, you just want to, especially if you deal with people who are dissociating a lot, like who are not present. For example, one time I never forget working with an adolescent who had just witnessed, no, actually she was involved in a car accident where there is a loss of a close friend. So she would just curl and sit like that. She was not there at all. So we had to spend a lot of time asking her to sit, to put her feet on the floor, stomp the feet on the floor, grab something, squeeze it, look at 4 things, the 5 senses. Like, you have to be very sensorial. Grounding, it's basically using your 5 senses to bring yourself to here. We are here, and here we are safe. In this moment, we are safe, if you are, of course, right where you are practicing those things. So you want to be here. You want to give yourself this break, ground yourself in this moment where you are safe, and bring your senses to here. So you can use the 4 things you can see, 3 things you can hear, 2 things you can taste, 1 thing that you can touch. You can have, adolescents doing self-soothing kits. I love doing that, getting a box, decorating the box, and having those 5 sensorial things that are treats that you're going to use as, a survival kit. I am in a panic mode. I'm going to get my kit, because you need to have there, not things that you already use every day. They are special. Like, let's say for taste, you have that dark chocolate, that it's kind of expensive. You don't eat it every day. So you want to have one of those there. You want to have, things that you have a bigger impact on your senses when you need to access those resources, and self-soothe and bring yourself to this self-soothing. You regulate, you work bottom, not top bottom, but bottom up. And then what happens is you can deactivate a little bit the amygdala, and you can think better about sending that text. It's not a good idea. And then you delete what you just typed, or, doing whatever you were thinking about doing, self-harming, all those risky behaviors too. Like, when you self-regulate, then you can follow, a series of, you can have a list of 10 things that you're going to do before you do, that other thing that is not aligned with your values and goals. So I also add a lot of these simple, quick grounding techniques. I also like the splashing cold water on the face, especially in this area around the eyes. There's a lot of things from DBT, dialectical behavior therapy, for self-regulation and emotional regulation skills that are helpful, that we can have as something that I need self-soothing fast, self-regulation fast. And then the other things like mindfulness that you want to practice day by day to create those new neural circuits to go that way and not your default mode way. Okay. Thank you so much for staying, and I stayed.